Healthcare costs should be lowered. The United States is the only profit motivated healthcare system in the world. And it's no coincidence that it is the country that has the highest cost for healthcare compared to any other nation. The United States national healthcare expenditure reached $4.1 trillion in 2020. That's about $12,000 per person. The amount will further increase in years to come. If you live in the United States, you're paying more than double the cost for prescriptions compared to any other country. According to the new study from West Health and Gallup, an estimated 17 million adults were unable to pay for at least one doctor's prescribed prescription during their doctor's visit. Even with healthcare coverage, the cost of healthcare continues to rise to meet the demands required to buy prescriptions and have regular doctor's visits. In addition, the average ER visit is $2,200. If you're ever in need of emergency attention or for any condition or if you had an accident, prepare to be in crippling debt due to the cost of an ER visit. If you have a chronic condition, however, things can get much worse. Next, let's discuss how healthcare works for people with chronic or constant medical conditions. As Ra Kumar says, in the United States, three companies control most of the market for insulin, contributing to the high prices. They are freely able to increase the cost of insulin and secure profits for people who cannot live without it. He further elaborates, saying, unregulated monopoly over an essential product can lead to unaffordable prices that can threaten the lives of citizens. Next, let's look at the cost of health insurance. This is taken from the healthcare marketplace where you can buy health insurance between the months of November and December for the following year. The premium plan here is $96.93 with a discount of $343 because of a tax credit that you receive if you make a certain amount of money. Without that tax credit, the actual plan is $439. Now, let's dive deeper into the prescription cost. The regular costs for the prescription seem fair. However, let's look at the section involving specialty drugs. One example is a Dexcom. A Dexcom is a device that constantly monitors a diabetic's blood sugar, and this can help maintain stable blood sugars and can even save them from having low blood sugars at night, which can actually lead to death. The cost of this medication is about $500 to $800 monthly. If you're paying 40% of that, then the lowest annually that you'll pay for this is $2,400. So while the plan may be about $100, the cost of the Dexcom is double that amount. This doesn't even include the cost for insulin, doctor's visits, syringes, and other supplies that a diabetic may need. That's the cost for a device that can help save your life. Lastly, there is hope, however, because there have been steps made to actually lower the cost of prescription medications, including insulin, that people need to live. The Inflation Reduction Act, introduced by Senator Warnock, capped the cost of insulin to about $35 for those who have Medicare. One example is Lantus. That's a medication that costs about $350 monthly, and it is an insulin. With insurance, you would spend maybe $70 a month, but with the introduction of the plan, that price goes down to about $15. This is a step in the right direction, but it does not exclude the cost of many other prescriptions, such as the specialty drugs that I explained earlier. As Warnock says, life-saving drugs don't do any good if people can't afford them. Healthcare is far too expensive, and the only ones benefiting from it are the companies who monopolize on the healthcare industry. The profit from healthcare services is estimated to be about 20 to 25% of the national expenditure for personal health services, which is about 70 to 90 billion dollars. Should other companies profit off of other people's need for basic health services, or should we be punished for needing medical care? Thank you.